Just want to welcome everybody. My name is Lorne Brown. I'm the chair of the Integrated Fertility Symposium and also the clinical director of ACUBALANCE Wellness Center in Vancouver. And today I have a great privilege to talk to an old friend, Dr. Mark Perloe. And when I think of Dr. Perloe, I actually think of PCOS. I know he does a lot of other things, but over the years, that seems to be always our conversation on what is it and how do we treat it. Can you just share for our audience a bit about your medical background and also what compelled you to learn more to better understand and manage polycystic ovarian syndrome?
Well, first I wanted to comment on old friend. Our friendship goes a long way back, but I noticed that over the years, I've developed all this white hair and yours looks about the same. You don't seem to age over the years. So that's the best proof on TCM and herbal medicine is just to see the difference in our aging here. So my family history, we have a strong family history for diabetes and heart disease, some cancer in the family. And as a result, I started doing research and reading. And as a fertility practitioner, I saw a lot of women who suffered with PCOS and the frustration that they had to see many physicians before they got a diagnosis. And even once they had a diagnosis, didn't feel like they were getting the care and the answers they needed. As I studied this, I found out that it was very similar, the diabetes and heart disease in my family, with some of the things that PCOS was presenting to these patients.
And you are a medical doctor, so you're medically trained. And for years, did you do IVFs with your patients as well? Like, what's your background because we're going to talk about fertility and PCOS. So maybe just a little bit background about your training and your experience treating fertility.
Sure. So I practiced obstetrics and gynecology after a residency for 10 years, spent time in the Indian Health Service, and I wrote a book about fertility. After that, I decided that if I wanted to understand infertility, I really needed to do fellowship training. So I did that and then moved to Atlanta and had a full service fertility practice. We did IVF, just basically everything you read about in fertility, we had the ability to offer our patients. My particular interest was PCOS and really looking at that organically. I know that there's an approach that says you come in, you had PCOS, your doctors gave you 3 cycles of Clomid, you're not pregnant, so now it's time to do IVF. And I really wanted to understand this condition because I felt like there were steps that could be taken that were easier, less stressful, and would have implications for health over the lifetime, not just addressing that one particular concern that the patient came in with.
So can you talk a little bit about why some women have trouble conceiving if they have PCOS, and why do women have difficulty getting this diagnosis of PCOS?
Well, the thing is, the diagnosis is actually pretty simple. There are 3 diagnostic criteria, and you need 2 of those diagnostic criteria to get the diagnosis. And that would be anovulation, you're not ovulating, or there are irregular menstrual cycles. Signs of male hormone excess, like excess hair growth, acne, or elevated male hormones. And ovaries that appear polycystic on the ultrasound. If you have any 2 of those and no other explanation, you have PCOS. So it's not that hard. It's interesting, though, that without ovulation and releasing an egg, you're not going to get pregnant. But it also has impact on egg quality, endometrial development, and implantation. Miscarriage rates can be affected. Many women with PCOS are overweight, and we know that obesity can play a role. And what's interesting, and I think this is where TCM and herbal medicine come in, is that when we look a little further, we see that many of the markers for inflammation, like C-reactive protein, are elevated. and that PCOS may well be a inflammatory condition that contributes to some of the fertility difficulty, development of the placenta, so that we really want to look holistically at the patient and address the androgen excess, address insulin resistance, address inflammation. And when we work together, and I've been lucky that I've had many practitioners that I've worked with over the years who really work together to help the patients deal with each of those problems.
So when you practice and you're treating PCOS, it is kind of an integrative practice or approach. So you're looking at some of the diagnostics. So you can do the ultrasound, you can do the blood test to look at high male hormones, those androgens, and look at the blood sugars. And then from the treatment approach, I want to talk a little bit about the Western approaches. But my understanding then how you work, it's not like they got to go straight to IVF or an ovulation drug. You do work with some Chinese medicine practitioners to work on diet, lifestyle, supplements, herbs, and acupuncture, as you said, to help with blood sugar, to help with those high male, to help regulate hormones, and to help with that inflammation. So do you embrace an integrative approach?
Oh, absolutely. So the best approach involves proper diet, exercise, and that's a mix of aerobics, but predominantly strength training exercise, as well as an insulin sensitizer. And with the Chinese medicine expert, we're looking at signs of inflammation, overall general health. The thing with PCOS that I think is a problem when a Western physician sees it, hears the problem, and goes after it. So it may be fertility, they throw Clomid. It may be irregular bleeding, so they put someone on birth control pills. It may be acne, so they use Accutane. It may be hair loss. So rather than just looking at one thing with blinders on, when you see a patient with PCOS, if we work together and address it holistically with all the different entities or areas of the body that are affected, we can promote health. We can reduce the risk of diabetes 70%, and by 6 months, up to 85% of people can be ovulating, having regular cycles. 65% can be pregnant within 6 months if they take all those steps to normalize the metabolic abnormalities seen with PCOS.
You know, in my clinical practice here in Vancouver at ACUBALANCE, often the PCOS patients we see, and I'll even say PCOS type, where they don't neatly fit into the category of they have 2 out of these 3 diagnoses, but they have a lot of signs or symptoms still, and they'll have had, say, ovulation drugs like letrozole, Clomid, not successful, or pregnant miscarriage or IVF. And sometimes we get those spontaneous pregnancies after 3 to 6 months of diet and exercise and the supplements, because they start to regulate, ovulate normally, or they go do another ovulation cycle or an IVF and they have that success. I don't know how much research is on there, but I've always been curious to, I think if it's about egg quality, then women that have been diagnosed or suspect they have PCOS, there's these less invasive things, small actions with big results, that if they do this over 3 to 6 months, they can resolve a lot of the symptoms and the fertility issues. Has that been your clinical experience?
Well, in addition to saving a lot of money, ultimately time, reducing the risk of miscarriage, and providing long-term health, I kind of step away from what I would think is the group thinking. If you're not pregnant by 3 cycles of Clomid, do IVF. I'd much rather understand the metabolic abnormalities and take the steps to address that before moving on. Because I think if you correct that, even if you have to look at ovulation induction or IVF at some point, the odds of success are going to be greater if you've addressed again, the inflammation, the male hormone elevation, and all the other factors that may go along with PCOS.
And my understanding from our discussions in the past, you have a big focus on healthy baby and healthy mom. And so are there medical concerns for women that have PCOS, whether they are able to conceive right away with an ovulatory drug or IVF or not, if they have this presentation of PCOS, are there medical concerns for the mother and even the baby during the gestation?
Well, one of the difficult things is a lot of people will come in and say, I've dieted, I've exercised, and I'm just not losing the weight. If insulin is elevated, insulin after a meal is a storage hormone. So you can take the calories in and you store them and you gain weight. So obesity is obviously a concern. High blood pressure can be associated. We find that many people who address this holistically are going to be able to get off their blood pressure medicines, and the elevated blood pressure will go away. And I also think that if we can correct this imbalance and the person trying to get pregnant gets pregnant naturally, they're more likely to get pregnant one baby at a time rather than be subject to multiple births and the higher risk pregnancies. Now, when the woman gets older, particularly those with C-reactive protein, we know that that's a risk factor for cardiovascular disease. And we find that normalizes once we focus on all the PCOS dynamics.
And then are there I'm going to just ask you some of the symptoms that don't come under your diagnostic criteria. Do you see cystic ovaries? Do you have the high male hormones, whether you see symptom acne, male pattern baldness, the extra hair, or the missing ovulation or delayed ovulation? Just some of the things that maybe you can describe a little bit why they have these. A lot of the women I see that have been diagnosed with PCOS, they can have skin tags or darkening of the skin, especially thickening around the folds of the neck. Can you explain what that's about? And again, if women are having this and having trouble conceiving, maybe they should get worked up for PCOS as well.
Well, that's certainly a sign. I call that the Walmart sign, that if you're standing in line in Walmart and you look at the woman who's in front of you and you see that there's a darkening of the skin in the folds of the neck, or skin tags, that goes along with elevated insulin. Sugars may be normal. We may see hemoglobin A1C elevated into a pre-diabetic range. But when we see those signs, it's kind of like you want to shake someone and say, you've got to be evaluated for insulin resistance here to prevent diabetes and other risks down the road. Now, lipid abnormalities are also seen with this. A strong family history of cholesterol abnormalities or diabetes. A woman who comes in with PCOS, about 50% of the time will have a sibling or a parent with type 2 diabetes. So that kind of goes hand in hand. So we look at the genetic history. Now, I talked about obesity before, but many women with PCOS are lean. And that's also a phenomenon. It behaves a little bit differently. But again, we have to look at all the factors and coming up with a plan to address and manage the PCOS.
And then again, this is not a definitive diagnosis, but high AMH, anti-Mullerian hormone. Most women want to have that high AMH because it's a good sign for ovarian reserve. But like anything, there's a great saying, and I think it's from Chinese medicine, too little is too little and too much is too much. So can you have too high of AMH? And when you see a very high AMH, do you also kind of want to evaluate them more and think about PCOS?
Oh, certainly. So one of the things that may be happening is in the normal process, you may have anywhere from 50 to 60, 70 eggs that are growing and they die off each month. They're always growing and you're getting new ones and they die off. In PCOS, the insulin may be keeping them alive, and those follicles that should be dying off are still growing and releasing AMH. So the very high level of AMH means that there's a lot of follicles around. So I'm not sure in Canada what units you use to measure it. We use nanogram per ml, and 1.5 to 3.5 would generally be the normal range. Once we see people 5, 10, and even higher on the AMH, we know that they've got a boatload of follicles, and the risks of going through ovulation induction and either having hyperstimulation or multiple births is pretty darn high. So by, again, addressing the PCOS, the AMH comes down to a more normal level. Again, that's not one of the diagnostic criteria. They've talked about including that, but right now that's just a finding, and it is a caution, so that if I see someone coming in with a very high AMH, I'm concerned about over-response. I'll look at family history. I'll see if there are other factors that may go along with PCOS, look at things like hemoglobin A1C and inflammation markers to decide how to proceed.
Then our last question, I kind of want you to walk me through. I'm a female patient. I've come to you because I'm having difficulty conceiving. You notice I have some acne. My hair is really thin. I got that darkness on my skin. I complain that I don't ovulate every month, and I'm having trouble getting pregnant. And I'm asking you, what should I be doing? And do I need to do IVF right away? And what's open to me, both from the Western and non-Western or unconventional, unorthodox methods? What do you know about?
So I think, again, I would say give yourself at least 3 months after we've evaluated things metabolically to let your body do what it knows how to do. And we're going to look at androgens. I'll look at hemoglobin A1C, which is a measure of sugar over a previous number of weeks. We may do an insulin glucose tolerance test where 2 hours after glucola, we're going to measure sugar and insulin. We'll look for inflammatory markers like C-reactive protein and cholesterol lipids. Because metformin is often part of it, we'll look at vitamin B12. Many of our patients also have low vitamin D, so we'll look into that and check thyroid and prolactin hormone, again, to see if there are other factors that might be interfering. Again, once we got that, then I hope people will take the time to meet with a traditional Chinese medicine practitioner to really look more holistically, because stress in your life increases the insulin resistance as well. Sleep apnea is one of the things that we'll oftentimes pick up or suspect on the history. And sleep apnea is associated with elevated cortisol and catecholamines that can cause blood pressure elevations and insulin resistance and make it worse. So we can't just look at, you want to get pregnant, do IVF. It's really a function of, let's get you healthy. Your body may do it on its own. We have IVF if we ultimately need to do that for you.
Dr. Mark Perloe, thank you very much for taking the time to share about PCOS and the integrative approach. It was great to connect with you again today.
Thank you.